Hello, I'm John Christian Fuentes. I'm going to perform a neurologic exam with the patient. Hello, sir. I'm John Christian Fuentes. May I ask your name and your age?
My name is Daniel Mark A. Fuentes and I am 16 years old.
Okay, so today we will going to perform a cranial nerve examination from your face and your neck. So before anything else, I would like to ask if you have a fever or pain.
I don't have any fevers or pain.
Okay, so do you have cough and cold?
No.
I would like to ask what's the date today and where you are.
It's March 31, 2022 and I'm at the clinic.
Okay, so general survey, patient is awake, alert, oriented and time and date, and no signs of distress. So, so first we're going to test your sense of smell. So can you close your eyes for a bit? Okay, tell me what you are smelling.
I am smelling coffee.
Okay, good. So in this part, we are testing the first cranial nerve or your olfactory nerve. So we ask the patient to identify the odor with both eyes closed. So expected findings is the patient is able to describe the odor. So next we will test your visuals. So can you sit here? So first we will test your visual acuity. So please hold this with your left hand 14 inches away from your face, and then close your eyes with your right hand. So can you read from the top to the bottom?
95, 874, 2,843,
Hindi, ano, no, 95,
95, 874, 2843, 638, 8745, 63925, 428365 374258.
Okay, let's do the other way around. So hold this with your right hand and then your left. Okay.
95874 2843 638 8745 63925 428365 374258 32.
In this part, we are testing the second cranial nerve or your optic nerve. So first we test the visual acuity using either Snellen chart, Rosenbaum, and then Jigger chart. So in this part, we use Rosenbaum. Expected normal findings is that patient has 20/20 near and far vision. Okay, so visual acuity is 20/20. So can you go back to your seat, sir? So next we will test your papillary reflex. So if it's okay to put light in your eyes, sir.
Yes.
Okay. Okay, so next we will do the swinging light test. So look straight, sir. Okay, so next look straight and then look at the pen. Papillary reflex is reactive to light and accumulation. In this part, we are testing the cranial nerve 3, 4, and 6. Test the bilateral pupils to ensure they are equally round and reactive to light and accumulation. So expected findings are pupils are equal, round, and reactive to light and accumulation. And in testing the abducens, both eyes move in coordination. So next we will assess your color vision, sir. So can you read the numbers in this Ishihara chart?
16 2 5 42 7 29.
Next.
6 57 10.
Color perception is tested by Ishihara chart. So normal finding is that the patient is able to identify all the numbers in the chart. Okay, very good. So next we will test your visual inattention. So sir, tell me, can kindly point the finger that is moving. Look straight. So next we will test your visual field. So it's the same, just close your right eye. Okay. Tell me if it's moving.
It's moving. It's moving. It's moving.
So next is the left.
It's moving. It's moving. It's moving.
Visual fields are tested by directed confrontation in all four visual quadrants. So next we will test your eye movement. So can you look at the tip of the pen? Okay. So in testing the trochlear nerve, both eyes of the patient move in the direction indicated as they follow the pen light. So next we will test your touch sensation. Can we sit here? So can you feel it?
Yes.
Can you close your eyes, sir? Okay, tell me when the tip of the cotton hit your face.
It hits. It hits. It hits. It hits. It hits. It hits.
Test for cranial nerve 5 or trigeminal nerve. In this test, we ask the patient to close their eyes and then use a cotton ball to lightly touch their face, forehead, and chin. Expected normal findings: patient feel touch on forehead, maxillary, and mandibular area of the face. So next we will test your facial nerves. So let's start by raising your eyebrows. Then close your eyes as tight as you can and then resist my hands. Okay, puff your cheeks and then resist my hands. Okay. And then show your teeth, sir. So first, I'm going to ask if there is changes on your teeth, sir.
No.
No. So next is test for cranial nerve 7 or facial nerve. In this test, we ask the patient to smile, show teeth, close both eyes, puff cheeks, frown, and raise eyebrows. So expected normal findings is that patient was able to perform all motor function without any difficulty. And then when asked, patient was able to distinguish different tastes. So next we will test your hearing. So can you move forward a little bit? So I'm going to whisper a number in your ear. So tell me, what is that number? 68.
68.
77.
77. 85. 55.
Okay, good.
So position A or position B.
Next, we test the cranial nerve 8 or the vestibulocochlear nerve. So in this test, we perform the whispered voice test, which is a simple test for detecting hearing impairment. So expected normal findings is that patient was able to hear the words whispered. So next, we will assess your balance. Can you stand up, sir? So I want you to close your eyes and then march in place. Okay, good. Can you back? Can you see? So in this part, we use the Romberg test or the test for balance. The patient was asked to stand on their feet together and close eyes and then perform march in place. So expected normal findings is that patient can walk upright and maintain balance. So next we will going to test your hypoglossal nerve. So can you say sir? So can you cough for me, sir? So next, we test the cranial nerve 9 or the glossopharyngeal nerve. So we ask the patient to open their mouth and say and note symmetry of the upper palate. The uvula and the tongue should be in the middle position and the uvula should rise symmetrically when the patient say So expected normal findings is that gag reflex is present. So can you drink this water, sir? Just swallow. Okay, good. So next we test the cranial nerve 10 or the vagus nerve. So in this test, we ask the patient to drink water and identify if there is difficulty in swallowing. So expected normal findings is that patient swallows and speak without difficulty. So can you sit here, sir? So I will assess the power of your shoulder and neck. So first, let's start off by raising your shoulder and resist my hands. Raise your shoulder. Okay, good. So next, we test the cranial nerve 11 or the spinal accessory nerve. Next, we test the trapezius muscle. In this test, we ask the patient to elevate or shrug the shoulder while I add resistance pressing down. Then turn your head left but resist my hands. Okay. And then move to the right. Okay. So in this test, I asked the patient to turn their head to the left while resisting the pressure I exerted in the opposite direction. So expected normal finding is that the patient can shrug shoulders and turns head side to side against resistance. So next we will inspect the tongue. So first open your mouth for me. And the next is stick your tongue out. Okay, good. Then next, we test the cranial nerve 12 or the hypoglossal nerve. So we ask the patient to protrude the tongue and observe if there is an unilateral weakness present. So expected normal findings is that the patient's tongue is midline and can be moved without difficulty. So next, sir, we will perform your motor system. So first, now we will test the muscle strength. So in this test, the patient will flex and extend each muscle and the examiner will apply resistance to it. So normal findings of this test is that the patient was able to apply resistance and have full strength. And then put your arms like this. Pronator drift. So the patient is asked to hold arms at 90-degree flexion and elbow fully extended at the shoulder level in front of them with palms upward and hold the position. Expected normal result is negative. It means the patient is able to maintain the position. Go straight, then close your eyes. Then hold it for 20 seconds. One hand lang. One hand lang sa... Okay. Then up. Then up. Okay, up. Okay. Next. Then na put. Sideward. Up. Okay, good. Arm sideward. Resist. Then put your arms like this. Go straight. Just resist. Okay, good. Then put your arms like this. Straight. And then resist. My hands. Okay, very good. Next, we will test your grip. So grip this. Grip. Grip my hands. Okay. The flexion of your fingers. So this is. Okay. So next, put your arms like this, and then stand up. And then sit down. So first, raise your right knee. Okay, resist. And then the left. Okay. Next is raise. Raise your, and then resist. Okay. We will test the gait. So in this test, we will ask the patient to walk back and forth and look for disturbances of posture, balance, loss of arm movement, or abnormal leg movement. So normal findings is that normal gait is effortless with arms swinging easily at sides and turns are smooth. So next test, we will test the patient's coordination. So first test is rapid alternating movement. In this test, we will ask the patient to turn one hand prone to supine back and forth in his thighs. So expected normal findings is that the patient should be able to do this rapidly and smoothly. So the next test for coordination is the point-to-point movement. So in this test, using the index finger, the patient should be able to alternately touch your index finger, then his nose back and forth. So expected normal findings is that the patient movement should be accurate without tremor or dysmetria. So next we will test the deep tendon reflex. So in this test, the examiner taps the muscle tendon with an examination hammer, and the response is observed and graded. So the normal findings of this test is there is a brisk response which is graded as 2+ or normal. Sa leg. Okay. The next step is the Babinski reflex. The Babinski reflex is a test by stroking the underside of the foot from the top of the sole towards the heel. So expected normal finding in adults is that the foot and toes will curl inwards. So the next test is the Brudzinski sign. So it is a way to diagnose meningitis. To perform this test, we ask the patient to lie flat and then we put one hand behind the head and one hand on the chest. And then we lift the head, bringing the chin to the chest of the patient. So in normal cases, the flexion of the neck will not cause flexion of the hips. And we will note it as negative. Another special test to diagnose meningitis is the Kernig sign. So in this test, we ask the patient to lie face up and then flex the knee and the hip in a 90 degrees angle while us doctors will slowly extend the knee of the patient. So expected normal findings in this test is there should no resistance or pain. So in summary, we have assessed the patient's mental status, the cranial nerves, the motor system, sensory system, reflexes, and perform special techniques. So that would be all. Thank you.